The world reacting swiftly in the face of a new coronavirus variant that has emerged and which some scientists say may well be the worst yet. The formal identification of this came just this week in South Africa, the European Union joining now a slate of countries, including the UK and Israel, unilaterally banning flights from the region. The news has spooked markets globally. Stocks, futures plunging already today. Dr. Anthony Fauci, the top infectious disease official in the United States, says American experts are in discussions with South African scientists, but says it's too early to impose travel rules yet for the U.S. We will watch for an official response from Canada's Public Health Agency, set to deliver a briefing at 11 a.m. Eastern. More on that to come. But first, let's go to Tessa Arcilia in London with more on what we know, the latest developments in this story today. Tessa.
Heather, indeed, it is fast moving. Just before we went to air, we got confirmation from the Belgian Health Ministry that there is one case confirmed of the new variant there. So it has reached European shores, and that is in addition to those identified, of course, in South Africa, Botswana, Israel, and Hong Kong, which is a particular interest to us as we are working to independently verify whether one of the two cases identified there is indeed a person who had entered from Canada, because one of the two had entered from South Africa, and they were on the same floor opposite each other in the quarantine hotel in Hong Kong. That is a reporting according to the Hong Kong public broadcaster. Now, this is worrying, as you say, fast developing, because there are questions on the transmissibility and the level of infectiousness. So far, the contact with South African doctors and specialists, they say the R level there at the moment is at 2. You know, anything above 1, Heather, is worrying. That means an exponential spread. You mentioned Dr. Anthony Fauci in the U.S. earlier. Take a listen to what he said.
To find out scientist to scientist exactly what is going on. But it's something that has emerged in South Africa and seems to be spreading at a reasonably rapid rate, in the sense of when they do test positivity, they're seeing that it's a bit more widespread in South Africa than was originally felt a couple of days ago. So it's in a fluid motion. We're finding more about it, and literally it's something that in real time we're learning more and more about.
Indeed, so I spoke to some experts here, Professor Linda Bold earlier, explaining to me why this is worrying. They said that the new variant has at least 30 new mutations in the spike protein. That is what is trying to break into human cells, and this is double what they found in the Delta variant, which we know is the world's dominant variant at the moment. And so there is, the problem is that the current variant is so different from the original variant upon which our current vaccines are based. So the big question is, are our vaccines still effective? We don't know. We'll have about 10 to 2 weeks, according to Dr. Bold, to find out whether to find out some of these answers. And of course, we're waiting for the World Health Organization to tell us whether they think this is a variant of interest or a variant of concern, which will, of course, impact policy around the world. Heather?
One of the policies that we've already seen some countries move to enact, Tessa, travel restrictions. What is the latest there? Not just the UK anymore.
No, not at all. And the number of countries increasing. So here in Europe, of course, there's the UK, Germany, France, and the European Union as a whole trying to coordinate a response. And they say they will put all measures on the table. And now that there's a confirmed case in Belgium, we're waiting to hear whether they will impose a travel ban as well. Take a listen to what the UK's transport minister had to say about that.
I think it's important that we do put safety first. The UK Health Security Agency made this recommendation. We have acted, and we know from coronavirus, from lots of experience now, that you can never stop these things, but that early action buys you more time.
I think it's important to just reiterate what he said there, Heather. There is agreement among experts that there is no longer the idea of stopping the various spread, because it will spread. It's just a matter of getting the science to catch up to it and be able to fight it as well. Heather?
Thank you very much. Tessa Arcilia in London with the very latest developments.